The COVID-19 curve in this country is starting to bend in the wrong direction. New cases of the virus are rising in a majority of provinces. 368 new cases in Alberta over the weekend, 102 in BC, and 203 in Ontario over the last 24 hours. That's the most in about 3 weeks. And there's more. Most of those cases are people under the age of 40. I want to bring in our next guest, Dr. Howard Njoo. He is the Deputy Chief Public Health Officer of this country. A familiar face to our viewers. You see him nearly every day on CBC News Network. Hi, Dr. Njoo. Good to see you. Thank you for making time for us.
Hello.
I want to start off, actually, if you don't mind, with something that I just heard the president say around mortality rates. Are you seeing, he said there's a reduction in the United States in mortality rates there from the virus. Are you seeing that at all?
Well, in Canada, yes, we're seeing, I guess, a similar pattern that the mortality rate has been declining. So certainly the number of deaths reported to us in recent weeks has been less than previously. So I think that's a good indicator as well in terms of what we're doing in Canada in terms of flattening the curve, both in terms of actual case counts, but also in terms of the severe consequences, including death.
What do you think that's a function of? Is it that we are better figuring out how to treat it? Is it that it's more young people, so the mortality rate is therefore by nature lower? Like, what is this a function of?
I think it's a combination of all those things. Certainly, I think even as the president said, I think physicians around the world, including in Canada, we've certainly gotten experience in terms of how to deal with sick patients who have got severe consequences, need ventilators, and so on. And I think we've learned, and we've obviously, I think, exchanged with international colleagues in terms of best practices, the use of new treatments, dexamethasone, other drugs as well that certainly can help make a difference. So that's one aspect. But you're right. I think it's also the fact that we're doing a better job overall, I think, in recent weeks with respect to not having many cases among, quote, the elderly. So that's a good sign. But I guess, as you pointed out, the flip side is that we're seeing an increasing proportion of cases among young adults, especially those under the age of 40.
And I do want to ask you about that in some of the specific instances of that in various provinces in just a second. But just staying with the United States for a second, because I've listened to your press briefings every day. I remember last week you were comparing the average number of cases here, which was about 300, 350 at the time. I know it's gone up a bit, compared to about 60,000 in the United States. I know it's not your decision to make, but if you were the Prime Minister, if you were sitting in one of the chairs in Cabinet, would you be saying don't open the border until the end of the year or until there's a vaccine? Like, what would your advice be?
Well, I think that's a complex question, and we recognize that our relationship with the U.S. is important in so many ways. Obviously, culturally, socially, economically, I think it's something that I would imagine the Deputy Prime Minister, the Prime Minister, Cabinet ministers are seized with looking at all of the various aspects in terms of what could or should be done at the border. For myself, from a public health perspective, certainly, we've done a great job. I think Canadians across the country have made tremendous sacrifices. And as I've said, we've now succeeded in flattening the curve. Certainly, we've succeeded in terms of not overwhelming the healthcare system, as we all feared during the winter months. But that success is fragile. It only takes a few sparks and backsliding, and we may end up in a situation we don't want to be. So managing and continuing that tight control domestically is certainly very important. And then, as you point out, one of the other things we need to manage is the importation of cases. And that's why we have a very strict quarantine obligation now for all incomers to Canada. They have to go through a 14-day quarantine, which really is sort of the outer limit of the incubation period for this virus. And by and large, that's been successful, but it has come at a cost. And we recognize that in terms of, essential trade, but also tourism and other sectors have been impacted as well. So that's something we need to look at. And the only thing I will say, and I actually mentioned this at one of my press conferences, theoretically, it's interesting. I looked at how the European Union is managing, quote, its borders. And you may use the criteria that if you looked at country A and country B, one of the things you would look at in terms of why you might want to then loosen restrictions for travel across that political border is that if the epidemiology is similar in both countries, if you look at the healthcare systems, the public health systems, are the capacities, are the way they're managing the pandemic similar in both countries, you look at all those types of criteria, if it's basically the same in both countries, then certainly then there would be no reason to limit travel across that political border. But as we can see, obviously, that's not the situation right now.
Yeah, I guess bluntly then, as long as that is not the situation, from a purely public health perspective, would your advice be to keep the border closed?
Well, for the present time, yes. I would say that we need to carefully monitor all travelers from wherever who come into Canada. And yes, that would include the United States at the present time. Certainly from the evidence, I think most people can see that the epidemiology indicates that they don't have it under control. There's obviously several states where there's ongoing community transmission, lots of people testing positive. If you look at the positivity rate in terms of lab testing, here in Canada, we're about at 1%, which is a nice number. We'd like to have it even lower. But in the U.S., I think in some jurisdictions, it's obviously even in double digits. So that's not a good sign.
I do want to ask you about the Canadian situation. We're going to head to Alberta soon to hear from the Premier. There has been a spike, in Alberta. Yesterday, we heard Dr. Henry talking about the potential for explosive growth. It's a possibility, she said, in British Columbia. From your vantage point, we were expecting something to happen. We knew the numbers would tick upwards when the economy began to reopen. Is this in line with your expectations, or is it outside of what you expected?
No, it's in line. I would say that the number of factors in play, and the first one I would say is the fatigue factor. I think Canadians, by and large, as I said previously, have made tremendous sacrifices to flatten the curve. But we've been at this throughout our long winter into the spring, and I think overall there is a fatigue factor in terms of maintaining all those good public health measures, the physical distancing, the hand washing, now the use of non-medical masks and face coverings in public if you can maintain the physical distancing, and so on and so forth. So that's one factor I think that we need to be mindful of. I think the second factor, and I think this applies to the group we're now seeing for that, I would call it a bit of a mini resurgence in Canada, and that's young adults. And I think it's what I would call maybe the invincibility factor. I think young folks, I was young once, I can certainly relate to the fact that at a certain age, you think that, hey, nothing can really affect me. It's okay, I'll do whatever I want to do. And, the consequences, I'll manage and it'll be okay. And I think what compounds that is the fact that with young folks, as we've seen, and the evidence shows this, is that by and large, compared to the older age groups, they don't tend to have as serious consequences compared to older age groups. And in fact, many of them have mild symptoms, and sometimes even they're asymptomatic. But then that's what I think the challenge is, because even if they have mild symptoms or are asymptomatic, they are obviously part of our communities. And so there's certainly the risk when they go into the workplaces or they have elderly parents or grandparents. The risk of transmission to others is obviously high to those who unfortunately would have more severe consequences. So that's, I think, something we need to pay attention to, the so-called invincibility factor that young folks generally have at a certain point in their lives. And then I guess the third one, which you're pointing to, which we expect, which is I call it probably the reopening new normal factor. And the fact is, we do as a society have to open up, hopefully in a slow, prudent fashion. But there is obviously the potential, and we're seeing it play out, that as we start to open up the economy, as we start to open up bars and restaurants, I think public health officials are looking very carefully. I think the capacity is in place to make sure that, should cases arise, a cluster, that provinces and territories are able to rapidly test and diagnose those cases, make sure they're isolated, managed well. Then, of course, the famous contact tracing in terms of following up on the contacts. From what we've seen, that's also a bit worrisome because back in the winter, when everyone was, quote, staying at home, even though with a lot of cases, it turns out that the number of contacts per case identified was probably in single digits. Now it's crept up to double digits, 10, 15, 20 contacts identified for cases. And we know young folks tend to have more social contacts, and so that's an issue. the thing that we find also interesting, and I don't have any hard data, but we're looking into it, is the fact that obviously the young folks maybe are congregating in the bars and restaurants, and there have been some cases and outbreaks linked to bars and restaurants. On the other hand, a lot of the outbreaks and clusters have also been in what we call private indoor parties, where obviously there's probably a lack of social distancing and so on. And one theory is that maybe it's linked to the bars and restaurants opening, if only because it then creates a bit of a mindset that, hey, things are getting back to normal, and even though I'm not going to the bar and restaurants are open, so what the heck? Why can't I have a party with my friends at home? So that's something we're looking at. Well, it's interesting. We've actually had discussions at the Special Advisory Committee. I actually just spoke a few hours ago with Dr. Dina Hinshaw, Dr. Bonnie Henry, Dr. Barbara Yaffe of Ontario, and they all agreed in terms of it's a growing issue and a problem in terms of the young adults. We're going to have to, I think, as a public health community, look very seriously at I think, the issue and challenge of how do we reach young adults. Certainly, the traditional messaging through, maybe press conferences even reaches a certain demographic. But for the young adults, so we know that they maybe use different platforms in terms of how they receive their information. For example, my kids tell me, hey, you should have your own YouTube channel, and maybe that's the best way to reach young folks. So I think we need to harness the expertise of our risk communications experts, our behavioral science experts, and figure out the best way to target and segment this specific group.
Okay, I've got to leave it there, Dr. Njoo, but thanks very much for your time and insights this evening. Dr. Howard Njoo, he's Canada's Deputy Chief Public Health Officer. Thanks, Dr. Njoo. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.